So we reflected a bit on our profession and what it means to be a professional in continuing education in the health professions. And we looked at the broad range of competencies and skills that are needed, which really encompass a diverse set of team members. And the team is quite broad. It could be the core team that might be educators and producing content, instructional designers, but it also might be leaders, collaborators, stakeholders, patients that may help with your planning. And all of those roles warrant their own CPD plan, which means each of those roles need to step back, identify skills, competencies that are needed in order to be effective in the work that they're doing. So then we shifted from there and we looked at a framework that we could use, or curriculum that we could use around planning for CPD. And I do want to underscore the part of the feel of the workshop was that taking our CPD as serious as the CPD that we're doing for our constituents is really important. Budgeting time for that, building that into your regular reviews, your conversations, your regular team meetings, looking at feedback that you're getting from stakeholders, and taking that into account to chart your own improvement is very important. Self-assessing how we're doing and is good, but self-assessment's limited. You do need outside perspective. You do need outside benchmarks for the work that we need to be doing. So leveraging tools is very important. And I will note that a lot of those that are involved in implementing continuing education are not at fabulous meetings like this European CME Forum. They don't come to CPD activities like this. So that puts a bit of a burden on us to identify the elements of our profession and to regularly advocate for the value of our profession. So tending to our profession, making sure we're at the table with our leadership, with our stakeholders, showcasing the work that we're doing and what we're doing to make it better is really important, and a job never done. So we left with lots of practical tips to take home and to apply in each of our settings. So in a nutshell, that was our workshop.
And how do you see the future actually panning out, Steve? Or what would you say the main differences between sort of the US providers and the European providers that you've seen over the past few years?
Well, I think us as professionals, no matter where we're at in the world, are committed to the same thing. And so I've seen our worlds converge. Certainly accreditation and regulations tend to take a lot of time of what we're discussing to try and navigate things. But increasingly our conversations are about what's an effective way to educate people, especially as we've all been thrust into this virtual world instantly, as Game nicely predicted we would, certainly sooner than what we thought. But I think much of this conference has been about how to maximize engagement in a virtual setting. What are novel, innovative ways to educate people that are outside of the traditional live activity? So I think us as a profession are the same, whether we're in the UK or Germany or the US. I'm seeing the difference not matter as much today than a few years ago.
Great, thank you. And actually, we've got a question from the room as well, and especially pertinent with the topics that we've been covering over the past couple of days. How much reliance on informal and incidental CPD do you think CPD professionals have?
So how much reliance? That's a great question. I think there needs to be more reliance on informal CPD. So a lot of the practical things that came out in the workshop were just budgeting regular reading of journals. Are you reading Jack and staying up to date? Are you plugged into the news that's coming from the industry? And that's informal. It's just ensuring you're learning about best practices. You're learning about innovations. Are you conversing with your colleagues and getting feedback about how your events went. So it's hard to know how much reliance people are having, but certainly in the workshop, it emerged that we needed to make this part of our culture in each of our team settings. And that's something that it's just part of your language and part of what you do every day. So I think it takes both a strategic prioritization of formal and informal CPD to be effective.
Great. No, thank you, Stephen.
Ron, I see another question has come up about certification. So so the Alliance does offer a certification for educators in the health professions. And that's certainly a great way to honor the profession. And so we live in the healthcare environment where there's always acronyms and letters after people's names. And I think adding that does add a sense of quality to the profession that we have. And so I think making that part of your professional goal is a great idea. So there is discussion in the Alliance on broadening it so that way it applies in all cultural settings. Right now it's a little more US centric or North American centric. So I think future iterations of that will see that become more of a global edition of the CHCP.